Welcome, everybody.
Hello.
And all of you out there in outer space. I'm going to just kind of give you a brief overview of who I am, what I've done in my life, and try and encourage you to be nurses to come into the healthcare field. So I've always learned to start anything, it should be who, what, where, when, why. So who I am, my name's Janet. I'm a registered nurse. I'm 60 something years old. I'm a graduate of Troy High School, and I graduated in 1976. And for those of you who aren't aware, that was the bicentennial year. So it was very lovely. I wore navy blue. The next row wore white, the next row red. We looked like a flag out on the field. It was different, but yeah. So I graduated in 1976. I then went to the Robert Packer Hospital School of Nursing, which isn't the Robert Packer Hospital School of Nursing anymore. It is now the Mansfield School. You can get your healthcare education there. The first 2 years you go to Mansfield, the second 2 years you go to the Robert Packer and live in the dorms there. I started in 1976 and I graduated in 1979. Now, a little bit of history there is when 3 Mile Island melted down, okay? And for many years, they had no flies in that area of Pennsylvania. That's not a joke, that's true. My instructors in nursing training, because it was training, then we didn't have a lot of general ed courses at all. It was all nursing and psychiatry and anatomy, physiology, chemistry, all of that. So when I went to school, I've lost my whole train of thought. Oh, I had our director of nursing for the school was a colonel in the Air Force or in the Army, and the second in command of the school was a colonel in the Air Force in World War II. Yes, that's how old I am. More about me, I have 2 grown children. I have a son who's married, and he and his wife are both teachers. They live about 10 minutes outside of Washington, D.C. They drive like hell down there. Come to a stop sign, you should get away from it. It's just crazy. But they have 2 dogs. They're in the process of adoption. If you've ever seen the show Million Little Things, Rome and Regina have a beautiful pamphlet and they're working with an agent to get a baby. That's my kids. I have a daughter. She's in a long-term relationship with Alan, Lauren and Alan. They are both registered nurses who work at Geisinger Medical Center in the psychiatric ward night shift. So that's very, very interesting. Yes, and they've had COVID patients. They don't just have the people who need psychiatric care. They have everything there. She actually delivered a baby there. So, because people can't take their psych meds when they're pregnant, so then they have breakdowns, and yeah, so that was very interesting. They have 2 dogs, 3 cats, no children, no real sign of children. So, but when I was in nurses training, we were always encouraged to continue your education, always continue learning, because healthcare is changing. I thought they were full of baloney, but that is the truth. Healthcare is constantly changing. I've always wanted to get my bachelor's degree. I graduated with a diploma, and I am only 17 days from getting that bachelor's. What will I do with it? Thank you very much. What will I do with it? The same stuff I'm doing right now. Okay, it's not going to gain me anything other than, hey ladies, I got it. So that's who I am. What I am is a registered nurse. Okay. As I say, 17 days from my bachelor's. When I first graduated from nursing school, I started work at Towanda Hospital. I lived 5 minutes from the hospital, and that's where I started my job. I worked on the med-surg unit, the 3 to 11 shift. One thing I want to warn you all about is that you probably will not start Monday through Friday day shift. people probably start on the off shifts where they need help, and it'll be every other weekend, and it'll be every other holiday. And it won't be fun, but it is a job and you will love it. So I started on med surg unit, and then the next thing it was my supervisor, Jean Hardenstein, who never learned my name. I was always the kid. Hey kid, okay, go out to the ER. They need help out there. Okay. And then they get a call from the OB because we were still delivering babies there in 79. Kid, get back there, they're having a baby. Oh, okay. Yeah, I didn't know. The lady was taller than me. So I did what I was told. I'm going to tell a story. I'm sorry. So this lady, the patient needed a catheter because she was going to have surgery the next day. She needed a catheter put in, and she was kind of a large lady, and she had quite a big belly. And so, hey, kid, come on, we're going to put this catheter in. I said, okay. And I'm like, all right, I'm going to need some help getting under. So then they moved the bed away from the wall. Gary, the nurse's aide, was there, and he was helping to hold the belly up. And I'm under there, and I look up, and he's like sweating because the light for the bed was right over his head. And Jean, the supervisor, goes, don't you let go of that, you'll kill the kid. So anyway, I mean, I was never the person, I was always the kid. But I worked there for over a year, and then I thought, I'm going to go back to the Packer. I wanted to work in the emergency room or intensive care, and I ended up working in the Robert Packer Hospital in the intensive care unit, and that was very, very busy. But I learned a lot there too. I learned a ton at Towanda. So when you do get your jobs, really pay attention to the leaders, how they treat you, how they treat the people under them. And maybe you'll learn the person's name. Maybe not. I don't know. Let me see. I met my husband when I was working in ICU, and then I ended up working in cardiothoracic surgery and in the office. I followed the patients after their heart surgeries. I worked in the pacemaker clinic, which they didn't have at that time. So we started a pacemaker clinic. People who had permanent pacemakers put in. I was the person who checked them, programmed them, took people for walks, saw if the pacemaker was catching up or not. So that's what I did. I also, once we had the kids, I worked from home on a computer, where you had a C drive and had to actually type in what you wanted to find on floppy disks. And I put in data that we did in the surgeon's office. We did little things. So you send out forms and they fill it in. What are those things called?
Surveys.
Yeah, that's a good word, survey. So we did surveys. And so those would come back and I would input that data. They had what type of surgery and what medicines are they on? How are they doing that? So when you would hear things like, according to the Society of Cardiothoracic Surgeons, you should stop your salt. Or you should take this medicine, it's been proven to decrease your cholesterol. That wasn't just me, but yeah, that was me. Then I ended up in long-term care, not as a patient, but as a nurse. And that I found I really loved. In long-term care or skilled nursing, it's called, you get to really know those patients, residents, they're called. You get to know their family, whether that's good or bad, you get to know the family. And you really work well with the doctors because you're there every day with those patients and the doctors need your help in deciphering, well, they're acting like this, so that always means they've got a UTI. They're acting like this, so, this happened or that happened. So as you get into your jobs, you really need to know not just what's happening today, but what happened before, why they're there, where you're at now. I started out in long-term care as a floor nurse, the person passing the medicines, doing the treatments. supervising the nurse aides. And then I ended up being a supervisor, which meant I was responsible for the whole building. And I started out in Athens at Heritage Nursing Home, it was called. And then we moved to Lycoming County. So there I was more supervisor, but if there was a call up, I had to push a cart too. So yes, that was really my love. I loved that a lot. Where am I now? Now I work at Wyalusing Family Chiropractic, and that's another thing I just love. Every day I learn something new from the doctor. She's extremely intelligent and she loves teaching. In fact, the last 2 days, she and I were at a conference in Philadelphia. I'm not saying that we're directionally challenged, but it did take us 4 times to try and figure out how to get into the parking garage because it was at the airport, the Marriott Hotel at the airport. It's like, which garage? All right, back out onto back in. Anyway, so I am the office nurse that does the screening of all the patients. With COVID, we took away our little iPad where they could put in their own symptoms. I go out, I check their temperatures, ask about their any illnesses, and find out why they're there today. So then I assist the doctor with new patient assessments, and I do finger sticks for our food sensitivities. I do all the vital signs for people, and I scan for orthotics, the insoles in your shoes. So that's where I'm at right now, and it is a great place to be. We have a lot of fun there. Next question, why I became a nurse? Well, here's where I would ask, why are you all interested in healthcare? But the crowd is right here right now. I don't think they're really interested in healthcare. So the reason I became a nurse, well, I grew up on a farm. And so there were always interesting things happening, between the cats and the dog and the cows. And, I remember once my dad listening to the cow tapping its stomach and goes, I got to call the vet, got a misplaced stomach, which is true. So then we had to haul the cow to Bachelors Center, and they carefully gave the cow anesthetics. We laid the cow down, cut her open, and he felt around in there. And I'm like, wow. I think I was maybe 14 when this happened. He goes, you want to help? I said, yeah. So I got to actually stick my arm in and feel this is this, and we're going to pull it here and stitch the misplaced stomach back to the inner wall of the abdomen and woke her up and we took her home. So that was one thing, was very interesting to me. My grandparents, I was fortunate enough to have my maternal grandparents, my paternal grandparents, and even great grandparents. So longevity of life I've been able to see, and as people get ill, see that too. So I was always interested also in science and healthcare and lab work. And here's another old thing, but there was a TV show, Quincy, Medical Examiner. All right, somebody's nodding their head. And they always solved everything by the end of the day. I just thought that was wonderful, to how they could take maybe, a drop of spit or a hair and fingernail and figure out what happened. That was interesting to me. But I think what really tipped me to being in healthcare was when I was 11 years old, I needed to have my tonsils and adenoids removed. So I was in the hospital. And at that point, that time, which was probably 1969, 1970, you had to stay overnight. It wasn't an in and out thing. So I'm there, and I had trouble. I had a lot of bleeding, so I had a lot of scabs in my throat. So there I am overnight, and Mom's there. I have an IV run. I have to go to the bathroom. It's the middle of the night. Ring my bell. I'm like, go to the bathroom. I can't talk. Ring the bell. Nobody's coming. So I'm like, Now, keep in mind, this was in 1969. I had an IV running, but it was on drip. In other words, they timed the drips. It wasn't hooked to a machine. So there was nothing plugged in. So what did I do? Grabbed it, scooted to the end of the bed, crawled out over the foot of the bed, and went in the bath. So I'm in the bathroom, and the nurse comes in, throws open the door, and yells. She yells at me, "What do you think you're doing? You shouldn't be out of bed." I said, my mother slept through the whole thing. Thanks for staying with me. We were big help, but that's okay. She got a good night's sleep. So I remember as she marched me back to bed, nobody should be treated this way. I had to go to the bathroom. I rang my bell. You didn't come. Just say, "Oh my God, are you okay? Why yell at me?" So that was probably what really got me going into healthcare. So then I was a candy striper. Actually, I had a girlfriend who was 2 years younger than me. And so she was 14, I was 16. And she goes, "Hey, Janet, let's go be candy stripers." Because she wanted to be a candy striper. And I could drive and she couldn't. So I could take us on that and see where she was going. I said, "Okay." So off we became candy strippers down here at Towanda Hospital. And we worked evenings. And that was a really fun experience, really and truly it was. As candy strippers, we got to do a lot more. We actually worked as nurse aides, truly. We fed people, we walked people, passed the ice water, helped get them ready for bed. So we did a lot. So that's my little healthcare background. Now, let's think about what professions would have been available to me as I graduated high school in 1976. I could be a secretary, or teacher, or a librarian, wife and a mother. That didn't really sound appealing to me. Or I could go into nursing. I mean, there weren't a lot of options in 1976. So you all now have a lot more options. The next question would be, what has changed in nursing and healthcare? First of all, the uniforms, okay? I came from work. This is my uniform I wore today. I have all different colored uniforms, okay? And I can wear sneakers or shoes. When I graduated nursing school, it's a white dress, not slacks, a dress. My cap, which made me look like the Flying Nun, white dress, white stockings, and white shoes that your great-grandmother probably wore. So that's the first thing. Second thing, certainly, is the technology that's available to everybody now. For me, if I didn't know a drug, I had to dig out the PDR, which was probably this big, this thick, and try and find it in there and figure it out. Now, Google, okay, that's that, got it. But the technology for the patients too. In the 80s, if somebody had, let's say, heart surgery, because I'm familiar with that, the bypass machine was at least as big as this table and as wide. And now it is about this big. The IV pumps that you hang the IV bag, you thread through there, and you set what you want to do. Now you can have 4 of those, 4 different things going on at once. If somebody has a pacemaker now, it's not just pacing the ventricle, it's pacing the atrium and the ventricle, and it probably defibrillates the person too. So, and they're smaller too now than they were. Everything is smaller now than it used to be, and more advanced. Diabetics now can have a little pin here that they can check their blood sugar with their cell phones. Okay, they don't have to stick their fingers. That's what that is. If they need insulin, people who are on insulin, they have a little tiny pump this big that you put the cartridge of insulin in and through a needle, and it senses when you need the insulin. You can set it for, oh, okay, yeah, my basal rate will be this, and my coverage will be this. It doesn't. Children can wear them now and look at them and go, yeah, I'm okay. Okay. I mean, to me, it's amazing what we can do now in healthcare. And it's only going to just keep going and keep going with science and technology. There's no end to what can be seen. Another thing that's changed is attitudes. This is how old I am. When I was in nursing school, we were taught that when the doctor came on the floor, you got up out of the chair and you got all of his charts in a stack for him. And you stood there until you got yelled at, because you would get yelled at. Doesn't matter. That doctor's word was final, and you didn't argue. You didn't say, hey, what about this? Or hey, what about a little bit of Lasix? Or do you think it's hard? Or do you think it's long? Oh, you didn't question. No. Now, nurses and doctors seem to work far better together. Of course, I'm bold, but I never had a problem calling a doctor and saying, hey, your patient so-and-so, this is what's been going on, and this is what happened before, and I don't know, but this is what I think, I don't know. And they would listen to you. Another thing that's changed is when I went to nursing school, there were 2 boys, men in the class. 2. Neither of them graduated. But there were just the 2. And all the doctors were men. Okay, I didn't see any females in residency when I was in nursing school. It was all men. And now I think it's pretty much half and half. I think you see a lot more nurses who have gone on to be nurse practitioners, and so they actually have their own offices. You can see patients. So a lot has changed. Hold on here. Next question. What can you expect if you become a nurse? I think the first thing is you can expect enjoyment. Nursing has been a role that I have loved all my life, and I continue to love it. And one thing you can keep in mind is you will always have a job. You can always find work in healthcare, always. And if you are aware of the fact that people are getting older, present company excluded, the average age, I'm not certain of the people in America now, I think it's like 60s. We're in our 60s, we're the baby boomers, we're there. So we're going to need health care later on. You can expect hard work, very hard work. It's mental, it's emotional, it's physical. If you look at the medicine cards, if you look at trying to transfer patients, if you look at getting people in and out of bathrooms and whatnot, it's hard physical work, but it's great work. It's wonderful. It is the most rewarding thing you will ever do. Now, learning to be a nurse is also extremely hard work. There's the chemistry, anatomy, physiology, math, because you have to be able to figure out what doses you have to give to people. Communication skills, psychology, and you got peds and OB, and it's a lot of hard work, but it's well worth it. Because as healthcare professionals, you will be needed not only here in Little Bradford County, but all of Pennsylvania, all of the United States, all over the world. There's a nursing shortage, and it's not getting any better. Now, another thing you might expect is, oh my God, I'm burned out. You know what burned out means? I just had it, I'm drained, I cannot do one more thing. We've heard a lot about that in the last year with COVID, and I have a sister who's a registered nurse, and there are times she's called me on her way home from work, and she's like, oh my God, I just want to rant and rave. Oh, okay, go ahead. Because she's just exhausted to the point of, I can't go one step further. And if I'm driving and I don't have somebody I'm talking to, I'm going to fall asleep. So I saw a picture that was a selfie from an Italian physician in the emergency room in Italy at the height of the beginning of the pandemic. And he just looked absolutely drained. The lines on his face from the mask and the goggles, I just thought, oh my God. So you can expect there will be times when you'll say, I can't go one more day. I cannot do it. But you can and you will. You will. Longevity. There's a lot of us who are still working because we love it. Okay. Stepping stone. As a nurse, you have so many opportunities. It's not just working in a hospital. You have, I wrote these down and I won't remember them all. You have the opportunity to work not only in a hospital, but in offices, acute care, long-term care, community nurse, rural health nursing, be a school nurse, be an agency nurse, be a travel nurse, be an industrial nurse, work in an OR, the pediatrics unit, the maternal child health care, psychiatry, orthopedics, wound care, ostomy, dialysis, neurology, pulmonary, cardiology, or you could be teachers. That's just like the tip of the iceberg, for sure. You could be a research nurse. Last spring, my class was statistics. It didn't make any sense to me because it's not math, okay? It's like a science or something. But I actually had to have a tutor. And this poor kid, and this was, I started with a tutor before COVID. And I knew I was going to have trouble in statistics. So class started like the middle of January. By the first week of February, I'm calling the school, Mansfield, and I said, I need a tutor. Oh, okay. So they call me back and they say, okay, we have a guy lined up and it's Tuesday and Thursday mornings. And then you just come to the learning center. I said, oh, that's unacceptable. As I told you before, I work full time. So he needs to be online or just by phone. Can't we just look at each other, FaceTime, some sort of time thing like that? And whoa, we've never done that. I said, seriously? I said, I'm sure you have an IT department. And if not, just give me the kid's phone number and I'm sure can figure out how to FaceTime so you can talk to me. Well, a couple of days later, then they have it all figured out. And yeah, we did Zoom back and forth 2 mornings a week, and that worked very well. And surprise, within a month, the whole college was Zoom, wasn't it? So anyway, but with research, I have gotten so many emails all last summer and into the fall about come be a research nurse, come join this team, come travel all over to get statistics. I said, no, my dad's 91. I'm not leaving the county. So anyway, there's lots and lots of opportunities. So if anybody has any questions. Yes, sir.
When you were going to nursing school, did you recognize, I think a lot of folks didn't realize that when you become a nurse, I think a lot of people assume it's always direct patient care. Were you aware that there was jobs outside of that direct patient care for nurses?
No, I thought it was just hospital. You know, our doctor's office, it was a family doctor and it was in his house. So you just went in, you waited your turn and he took care of you and that was it. So I didn't realize that there were office nurses. I'd only been at it was Guthrie once, and that was for dermatology, and that was just a secretary. And then somebody took us back, but I don't remember who. But she didn't stay there, and she wasn't really acting as a nurse would act. So no, I thought it was all hospital oriented. I didn't realize that every industrial plant needs a nurse. So at least one, if not 2 or 3. School nurses. I mean, I knew of school nurses. My cousin was a school nurse, but other than that, no. I didn't realize all the stuff you could do out there. And even with the director of nursing and the assistant director being military persons, I hadn't really thought of that as an option to go into the military to get my education. Or once I had my education, to go into the military. So, yeah, there's so many opportunities. Yes, again, so.
So for the students who out there who are thinking about nursing, but maybe on the fence, if it's the right path for them in healthcare, what would you say the biggest selling point is about being a nurse that you enjoy the most?
What I enjoy the most is dealing with people. I'm a people person, so, and I like to solve a mystery. So a patient will come to you and I have, a runny nose, I have a headache, my ears, I can't hear, when I swallow, they click and clack. So you have those symptoms, so you have to figure out what the solution will be, what the problem is and what the solution is. So that's it. I like dealing with people. I like helping people. I'm a cobbler. I'll admit that. Can't help myself. Anybody else?
Thank you so much.
You're welcome. Good luck to everybody. Good luck to you. And stick with it. Please, we need help.
Right, so I'm Chris Martin. I currently am the continuing education coordinator here for Lackawanna College at the Towanda Center. And I'm going to talk to you a little bit about the programs that we offer in the Con Ed department up here in Towanda. And so primarily we deal with allied health programs. They're the certificate-based programs that you could get when you're working in the health field, such as medical assisting, phlebotomy, and administrative medical assisting. So these are great programs for students who are interested in entering into the medical field, either as a career or they could be stepping stones as well. Meaning that if you're not quite sure where you want to go in the medical field, maybe you need a little bit more time, but you want to get in there and get your feet wet, it's a great opportunity for you to do that. So one of those things would be, I'll start off with, let's say, phlebotomy. So a phlebotomist is a person who goes out and does some blood draws on people for either diagnostic or therapeutic purposes. They're cringy faces. Ew. But it's a great rewarding career. And the reason why is because you are getting that information that the doctors need in order to provide that diagnosis that those patients need so that they can get better for both themselves and their family. And so it's very rewarding. It's a great profession that is very high paced. If you get into the hospital setting, it's, the ERs and the calls and so on and so forth, but there's many avenues that you can take in phlebotomy as well. You can not only work in hospital settings, but you can work in doctor's offices. You can work for blood donation centers where you go out and do the blood collections for the blood drives. You can work for insurance companies where you go out to people's homes and do the testing for life insurance and so on and so forth. And so there's many opportunities that you can do, which, as well, that could be like a traveling position. So you're not necessarily stuck in one place. So it's a great opportunity to get your foot in the door. That can also lead you into those nursing careers or any of those avenues. Sometimes if you get into the hospital setting and you're drawing on different floors and you see different avenues of nursing or different avenues of other healthcare professions, it's a great way for you to see those and work yourself into those as well. So another position that we offer here is the medical assistant. And so a medical assistant is a multi-skilled person, professional who does both administrative and clinical skills. So on the administrative side, this person is going to be working in a doctor's office, an urgent care center, clinics, things along those lines. It's not really made for inpatient hospital settings. It's more designed for that outpatient center. And so on the administrative side, they're going to be collecting your information, entering your demographic information into computers. They're going to be getting your insurance information. They could be doing some insurance billing. scheduling both the patients for return visits as well as scheduling for any type of diagnostic testing that they might need to have or something along those lines. So that's the administrative side. Now, the clinical side of the medical assistant does much more. They do things as far as vital signs. They can do phlebotomy procedures and lab procedures. They're going to do EKGs. They're going to be giving immunizations or injections. They can administer medication as long as that physician gives permission. In many states, you do have to have, you're under that physician for those requirements. So not every state allows you to administer immunizations or injections. The majority of them do. So you're going to be doing those skills as well as getting patients ready for their exams. You can be assisting physicians with their any type of procedures that they're going to be doing. You know, what's nice about this is you can work in many different fields of medicine. So you can work in OBGYN, you can work in pediatrics or with geriatrics, or you can do things with musculoskeletal. All those different avenues, you're actually trained to assist the physicians in those fields. And so it's very rewarding, and it's, you know, in that way that it's, you know, something if you have a certain interest, you can always gear towards that field as well. And so that medical assistant can either do both administrative and clinical skills, or they can be hired to work in one or the other. If they have a preference, they can do that as well. And so this is a phenomenal field, actually, if you are interested in nursing, because it introduces you to so many of those nursing skills that you would be learning. Basically, this is one step under a nurse. You're actually trained to do a lot of the same skills as LPNs are. You just don't carry that license. You do carry a certificate though. And so like I said, it's a very great career, or it can be an awesome stepping stone if you're interested in pursuing that nursing career. Now, the other thing that we do offer here is administrative medical assisting, which is just that administrative component of that medical assistant course. And so you would be strictly doing just those administrative skills that I had already talked about. So any questions about any of those fields? Yes.
If someone's on the fence for the medical administrative assistant, if they want to do more the medical or the administrative, do you have any suggestions? Do you have anything that maybe that person can kind of help guide them in the right direction of which avenue is best for them?
So basically it falls back on what your interests are. Where do you see yourself? And I tell students this all the time when they're trying to decide, even between phlebotomy and medical assisting. Do you see yourself in more of a high-paced environment? Do you see yourself, more laid back? Do you want to be on that 24/7, 365 schedule like you would be in a hospital setting versus the medical assistant side, which is more, it's office hours. So it's, 9 to 5, normally 5 days a week, half a day on Saturday. So that's beneficial. As far as the administrative, it's basically what it comes down to is, do you see yourself doing those clinical skills? Are you squeamish when it comes to blood? Are you squeamish when it comes to needles? Those types of questions are the ones that you need to answer for yourself as to whether or not you feel that you're a better fit for the clinical or the administrative.
If I wanted to speak to someone to help kind of guide me here at the school, who should I reach out to?
So currently in Towanda, you're going to reach out to me. Or you can reach out to our Denise, who is our enrollment specialist. She can also help guide you. Or incoming, the Con Ed coordinators would be also helpful as well. Our center director, Brad, is a great resource too. He can actually help you with those. So pretty much anybody and everybody here at the center can help you. But primarily it's the continuing education coordinator who would be the person that you would go to for the in-depth information.